Are you a pitcher that's dealing with elbow pain with throwing? I'm going to go over today why you need to make sure that if you have elbow pain with throwing, you are evaluated by a baseball rehabilitation specialist or a physician with extensive baseball experience. How do I know this? I'm Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I have helped countless baseball players, primarily pitchers, get stronger and get back to throwing pain-free. So again, I want to go over today elbow pain with throwing. It's scary. If you're a pitcher, baseball player, any throwing athlete that's watching this right now, and you've dealt with elbow pain with throwing, you know it can be a really discouraging feeling. You're really just not sure what the future holds. If you're dealing with that, it can be scary. And I tell anyone that I speak to that's a baseball player, it is not normal for you to have pain with you throw. If you are having pain with even just a couple throws or every time that you throw in your elbow, that is not normal. You need to stop throwing immediately and go be evaluated by a baseball rehabilitation specialist or a physician with extensive baseball experience. So, elbow pain with throwing. The reason I always recommend you need to get evaluated is because the elbow is complex. It is not just, it might be a small joint, but there's a lot going on in there. So today's video's purpose is really to show you what are some common signs and symptoms for some of these common injuries that I see in baseball players, especially pitchers, with in pain with throwing. So the first big one, UCL, ulnar collateral ligament. That is probably the one that gets the most attention in just mainstream media, mainly because that's what we're seeing more than anything in terms of injuries from both the youth, high school, and especially the professional level these days. When we think of UCL injuries, that's what's associated with Tommy John surgery, which is a reconstruction of that UCL ligament due to a complete rupture. So again, I do want to preface, though, not every UCL injury needs surgery. I've seen plenty of low-grade UCL sprains that get back to playing and pitching without problems. But full-grade, complete tears of the UCL or high-grade partial tears that fail multiple tries at conservative non-surgical rehab, those are going to require Tommy John surgery. So UCL injuries, typically, guys are going to have pain with getting into layback and right when they're coming out of layback. So again, that layback is where you're going to get maximum stress on that medial elbow in external rotation. That's why guys are likely going to feel that there. And then when you go to accelerate out of that, you're closing down that elbow. That's going to be a painful area as well. So really that late cocking, early acceleration phase of throwing, if you're starting to hear, hey, that's when I have pain there more than anything versus follow through. Again, not that it can't happen, but that's typically where we start to see some pain there. And what I do want to mention with all of these, you can have performance deficits. You could have drop in velo, loss of command, really just like throwing specific measures like that. So that's why you need to ask those questions, but just know that that necessarily is not going to point you to an extent of, hey, which is this versus that. So little league elbow. I see this a lot in my youth throwers. So the growth plate on the inside part of the elbow there, little league elbow is just another word for medial apophysitis, which is an inflammation of that growth plate. There are extreme cases of little league elbow where you can have a stress fracture of that medial epicondyle, or where you can avulse that medial epicondyle off, and then you need a pin put into that to stabilize it. But little league elbow, at its basis, is inflammation of the growth plate, and that is a chronic overuse injury more than anything, where that elbow is really, and that growth plate specifically, is just really inflamed from all the stresses of throwing more than anything. So typically with that, it's going to be in guys under 16 years old usually, because the growth plate is still open then. So this is a broad generalization, but you'll typically see UCL injuries in guys that are 16 or older, because by that point the growth plate has closed and is switched from the medial epicondyle being the most vulnerable to the ligament. So when they're below 16 and they have medial elbow pain, especially getting pain after like swelling after pitching along that medial elbow, you want to be thinking about little league elbow. Again, the age is going to be a big thing there. Same thing, they can have pain with either reaching back, coming out of that acceleration, because that's where you're going to get the most stress on that. I've also seen guys when they're finishing their pitches, they get some pain there because they're really heavily using that Flexor-Pronator Flexor-Pronator mass. Flexor-Pronator strain. With these, this isn't always the case, but these are probably going to be moved a little bit away from that bone. You can have guys that have strains very, very close to that bone, and at that point, it's more a matter of ruling out, UCL or other issues there. But so a lot of these guys, they're going to have some pain along this part of the forearm, maybe even radiating down here a little bit. You might have some swelling with there as well. Typically, these injuries, they're not going to have as much pain reaching back into layback. It's usually going to be that ball release and follow through. They're really having to spin off that ball, especially with fastballs. Changeups, especially, we have to get a lot more pronation with that. Those are two pitches where you might see those from some more than others. So you just want to be mindful of that in terms of the phase of throwing that's going to be painful. A stress reaction and stress fracture. So stress reaction, these are both chronic overuse issues. A stress reaction is there's not a true fracture line in the bone, whether it's at the medial epicondyle or back at the along the ulna. But a stress reaction is there's some swelling in that bone more than so you're getting a reaction in that bone due to which is essentially swelling because of the chronic stresses and forces of throwing. Stress fracture, that's where you have a clear fracture line more than anything. So stress reactions, if you keep throwing through that, you are very likely to lead into a stress fracture. Again, typically, it depends on the area that is most painful, but if you have a stress reaction along the ulna here, ball release and follow through, when they're getting into that terminal end range elbow extension where you're just jamming into that elbow, that's usually going to be the most bothersome part there. Loose bodies and impingement. So loose body is essentially when you have something floating around in that elbow joint. And most commonly with those symptoms, guys are going to feel like their elbow's locked. They're going to get to a certain point and it's just going to lock because whatever foreign loose body is in there is preventing them from reaching full, preventing them from reaching full motion into either flexion or extension. And impingement, again, that's usually impingement of the posterior-medial surfaces here as you're moving into that terminal extension. That goes a little bit back into the stress reaction and stress fracture. So one of the last things I want to go over is the ulnar nerve. So that ulnar nerve, it is made up of several nerves that come out from the neck. And that nerve comes and runs right down on the inside part of this elbow here. So if you find that bump, you dip off, there's a little groove, that's where your ulnar nerve sits. I've seen both in terms of which is painful and which phase or not, but typically you're going to see that late cocking, early acceleration because that's where we're going to get the most stress on that elbow. And I've also seen it at ball release and follow through a little bit as well. The symptoms of an ulnar nerve are much different from these. So typically you're want to thinking of if someone's saying, hey, I'm having a numbness and tingling down to my ring finger and my pinky finger because that's that ulnar nerve supply sensation to, that is what you need to be thinking immediately. In more advanced cases, you're going to see some weakness, some wasting of the muscle along here on the hypothenar eminence, maybe dropping objects, not able to have good grip strength. Some other things that are usually telling us this is a more progressed pathology is if that nerve subluxes. So if you see a guy, their arm is straight here, and they go to flex their elbow, and you see that nerve pop over, that medial epicondyle, that's not a good sign. In my experience, those do not respond well to non-surgical intervention because once that nerve is unstable and popping out, no matter how strong or stable you are in the dynamic muscular structures around there, that nerve is just unstable. So typically those guys end up needing surgery where they take the nerve, decompress, transpose it to the front here, tie it down with that Flexor-Pronator fascial sling, and that usually takes care of that nerve stability there. So again, numbness and tingling down the pinky finger, maybe some cold sensitivity, muscle wasting, loss of grip strength. Those are some of the common signs that we want to think there. So again, these are some of the bigger pathologies I see in youth, high school, collegiate, professional throwers when it comes to elbow pain with pitching. As you can see, there's a lot here. That's why you need to work with a trained baseball rehabilitation specialist to make sure that you have an accurate and appropriate diagnosis of what your injury is. So if you're a baseball player or pitcher currently dealing with some elbow pain with throwing, you have questions about your injury or the process of really getting back to pitching, leave a comment below with your question. Like and subscribe to our channel. We do a ton of content specifically dedicated to baseball player rehab and performance.